with low back pain. That's the most common patient I see, is this person with maybe some L4-5, L5-S1 joint dysfunction, maybe a little sacroiliac pain. And our protocol is that we use, a lot of times we want to start by trying to put the person through some passive range of motion. On this table right here, you can kind of get a separation to demonstrate. We've got the vertebrae here, and as it goes down into flexion here, we get some movement of the joint unit to help kind of facilitate movement there. We can also then lower the table and put the person into passive extension. If the person's having a problem leaning back or that creates some pain, we can kind of put the joint through that range of motion as well. Also, another thing we can do is rotate or laterally bend the person from side to side to work on range of motions that are restricted inside bending. We also like to address a lot of soft tissue. When we get a person with mechanical back pain, we're also going to have usually a lot of muscle spasms with that. We always like to start off with doing a little bit of massage work kind of through those muscle tissues, just trying to get them to relax. We'll follow that up with the application of some biofreeze to kind of go through. It's topical analgesic, works real well. We can then use that, kind of massage that in and go through range of motions and work on some trigger points or some other myofascial techniques to help loosen up those muscle tissues. Soft tissue, now we really want to get in and do some range of motions through the joint. As the body goes through some flexion here, we can then isolate a joint by applying some counter pressure. We can take the range of motion of a particular joint through both lateral bending. While we're doing this, we can also put a person into a side bending to really get some good stretch over here. Again, maybe use a little biofreeze to kind of go through the muscle tissue. Again, trying to work on loosening that up, go through its range of motion, so try to reduce muscle spasms and increase range of motion. Another aspect that we like to do after we've worked on the back is we like to turn them over, kind of work on, we can go through some range of motions, apply some extension to the lumbar spine as well as get some extension and work on the hip flexors here. We can also do a little stretch to where we kind of brace them here. Put some rotation in here so we can kind of stretch and kind of work on the rotators and the lateral benders of the lumbar spine. We can then have the patient turn and face me. And at this point, if we need to, this is where we can kind of come in and do the lumbar adjustment, and all that is just a little roll. We find the lumbar we want to move, and it's just a little thrust down.